Good afternoon. I'm Smith County Judge Nathaniel Moran. I'm joined here, as you see, on this Friday, March 27th, 2020, by Martin Hines, the Mayor of the City of Tyler, Ed Broussard, Tyler City Manager, George Roberts, who is the CEO of the Northeast Texas Public Health District, Dr. Jeff Levine, the local Public Health Authority, Dr. Thomas Cummins, who's the Division Chief Medical Officer for UT Health East Texas, and Dr. Mark Anderson, who is the Chief Medical Officer for the Christus Trinity Mother Frances Health System. The purpose of this press conference is to provide the public with continued important information about the COVID-19 pandemic and our ongoing strategic local response. Today you will hear from the individuals behind me regarding a myriad of matters pertaining to COVID-19 and the efforts of this community to combat it collectively. I spoke to many of you earlier this week, and we as a group, some of us here today, spoke to you about the extraordinary collaboration between the hospital systems, the City of Tyler, Smith County, the Northeast Texas Public Health District, the ISDs, our outlying cities, and numerous other organizations in our joint efforts to combat the COVID-19 situation. I want to now reemphasize how proud I am of those participating organizations. The Joint Emergency Operations Center has been extremely effective during this time, and it has allowed us to share information, build consensus, and to act rationally and deliberately throughout the past 2 weeks, constantly striving to make each decision based on facts, not fear. It has kept us on task and kept us accountable. I'll continue to give special thanks to Chief David Coble of the City of Tyler Fire Department and to Marshal Jay Brooks from the Smith County Fire Marshal's Office for their joint efforts to lead the EOC, as well as the Joint Information Center team who has put out daily briefings to the press. The first order of business today for me is to announce that within the last hour, I have signed an amended order of my original declaration of local disaster due to public health emergency for Smith County, Texas. This new order is a general stay-at-home order that will become effective tonight, Friday, March 27th, 2020, at 11:59 p.m. It will remain in effect for a period of 2 weeks until the end of the day on Friday, April 10th, 2020, unless I terminate it earlier or extend it with a further written order. I have issued this order today pursuant to my authority and my solemn responsibility to this community under Texas Government Code Chapter 418. The purpose of this order is to further protect the health, safety, and welfare of Smith County and its citizens beyond our current efforts. It is also to ensure that we, as a community, take affirmative steps to support our local health care providers and our hospital institutions by mitigating any spikes in COVID patient numbers in the near and the midterm. Currently, there are 27 residents of Smith County that have tested positive for COVID-19. In a moment, George Roberts from NetHealth will give us a more detailed update regarding that number and where things currently stand. Before he does that, though, let me make a few additional comments about this stay-at-home order. I will come back at the end of this conference to give you more detailed information about the provisions in that order, but I want to say a few things at the outset. First, this order is coming today because of, one, the continued growing concern surrounding community spread, two, the growing number of those who have tested positive for COVID-19 in Smith County, and three, information and briefings received just yesterday from our hospital systems regarding the numbers of patients being treated in those systems that have not yet tested positive for COVID-19 but who are presumed to have it, and the needs of medical personnel and continued personal protective equipment supply chain challenges. A lot of this information is confidential to the hospital systems and their patients, and I will not get into specifics about many of these matrices. Nevertheless, because of those briefings yesterday on Thursday and related discussions in the afternoon, I believed it incumbent to issue this order before the weekend in order to give lead time before next week's work week for businesses to make necessary adjustments. I informed the public this past Monday morning about my reluctance as the county judge to issue this type of order and my willingness to do so only upon the advice, counsel, and request of medical professionals, including our local health authority. At that time, we had 9 confirmed positive cases in Smith County. That number has now risen to 27. And yesterday, based on information received in our joint EOC meeting, there was a clear shift in the position of the members of the joint EOC Executive Committee, the local health authority, and with me concerning whether to put this type of generalized stay-at-home order in place. We all agreed then that the time had come to put such an order in place. I remain fully confident that our hospital systems and local health care providers are prepared to meet the expected needs of our community, and we continue to work in support of those efforts. This order is not the end of our efforts, nor is it the beginning of our efforts. It is the continuation of what has been our mission these past few weeks. Second, by signing this order, I do recognize that it will cause hardships to many in the community, economic and otherwise, and I am deeply burdened by this fact. I am also acutely aware that governments must take care not to overreach in times of crisis. Liberty is too precious a commodity, and governments should seek to uphold liberty, not to restrain it. Nevertheless, the health of this community compels me to act today. Third, I want to take a little liberty as the county judge to provide some important guidance and admonitions to the citizens of Smith County during this time. Even with this order in place, the primary defense to the spread of COVID-19 remains the individual decisions that we each make on a minute-by-minute basis. I cannot regulate common sense and cannot ensure good decision-making by every citizen in this county at every moment. That is left to each of us individually. So let us self-regulate. And even with this order, many necessary activities of daily living and many functions of life will still continue. In each of those circumstances, individual decision-making is crucial if this community truly wants to stop the spread of COVID-19. Wash your hands frequently. Keep your physical distance. Watch for signs of infection. Call ahead to your doctor before you go seek treatment. And behave as though each person you come into contact with is a COVID-19 carrier. By doing so, you will act differently and you will restrain the spread of this disease or this virus. Next, let me be a little blunt. As county judge, just let me take a little liberty here to say something a little bit off script. When I was elected as county judge a few years ago and appointed 4 years ago, but here recently as an elected county judge, I was elected as that, the county judge. I was not elected to be your mother. So be responsible for yourself and be disciplined during this time. The issuance of this order is not a license for personal recklessness. People will still be getting gas, going to the grocery store, etc., and this order does not prohibit that. So in our continued daily living, please exercise good sense and judgment as your mother would have instructed. Find constructive ways to occupy your time by helping others in need. As a faith-based community, we are called upon to love our neighbor. There are new needs as a result of COVID-19, so seek ways to meet these needs of those in the community. In a moment, Mayor Hines will be addressing some of the things that we're doing in this community to do that, but you don't have to wait on him to tell you how to love your neighbor and act accordingly. Find those ways and opportunities on your own and act accordingly. As a final admonition, we already know that mental health challenges in daily living are tough enough. And I realize that this stay-at-home order will increase stressors and pressures of life. So please take care of yourself during this time and be watching for signs in others of increased mental health issues. Eat right, exercise, get appropriate amounts of sleep, avoid unnecessary conflict. These are just some of the ways we can do better for ourselves and for others during this time. As I said in a bit, I will come back to the podium and discuss in more detail some of the provisions of the stay-at-home order before concluding with questions and answers. For now, I will turn the microphone to George Roberts, the CEO of Northeast Texas Public Health District. He will be followed by Mayor Hines and others before I close this out.
Thank you, Judge. Good afternoon. I'm George Roberts, Chief Executive Officer of the Northeast Texas Public Health District. I want to share with you an update on the count of the number of positive COVID-19 cases in Smith County. At this moment, as the judge said, we have 27 cases. Of these, 24 of these cases reside in Tyler and 3 in Smith County. Also, of these 27 cases, 7 are travel-related and 20 are community-acquired or community spread. And of the 27 cases, there's been 1 death, 9 cases are currently hospitalized, and 17 are at home monitoring their symptoms. In other cases, the areas we cover in Northeast Texas Public Health District, we work with 6 other counties besides Smith County. Currently, there's 4 cases in Gray County. 1 of these patients is hospitalized. And there's 1 case in Van Zant County. 1 of these patients is hospitalized. Once again, the symptoms of COVID-19 are a fever, cough, and shortness of breath. If you have these symptoms, please contact your medical provider. And before you show up at your medical provider to be seen, make sure that they're aware that you're coming so they can be properly prepared in personal protective equipment to greet you at the door. Again, the judge has mentioned some things here, but we have no vaccine for COVID-19. We have no medicines for you to take right now. The only thing we have right now is each other and public health measures such as, number 1, social distancing. Please stay 6 feet away from each other. And why do we say that? Because COVID-19 is spread by respiratory droplets. So me talking or coughing or sneezing can give that to you. That's why we say please stay at least 6 feet away from each other. Wash your hands for 20 seconds frequently. Stay home when you're sick. Let me repeat that. Stay home when you're sick. You only potentially get other people sick when you go out and you could potentially infect your neighbor. You don't want to do that. We're more responsible than that. Stay away yourself from sick people. Be mindful of that. Clean and disinfect the things that you touch, surfaces, doorknobs, your phone, etc. And thank you for your attention and for your compliance with these guidelines. We need each other to do these things well, and we will weather the storm. Thank you very much. Now, Mayor Hines.
Thank you. Today was our 12th day for the joint Tyler-Smith County Emergency Operations Center. I'd like to report again, we had 60 individuals, 40 on the phone, and 10 in 2 additional rooms. We continue to work through each operational item. And again, I want to stress, thank you to the county, all the hospitals, ISDs, all the emergency service districts, everyone. We are all working together on this. And the amount of preparation and organization is really showing today on different actions that we are stating today, but also will be coming out next week. There are certain items that in order to help the healthcare workers in the hospitals around these emergency districts that we will be announcing on Monday. There are several other agencies that are going to join with us to make sure that they get the necessary support, because many of these individuals will be on 12-hour shifts, and we're going to be working on ways that the Restaurant Association of Smith County will be helping provide some food, and we're going to have some housing, but those things will come. Today, I will state one thing that has been told us by the hospitals, that there are about 100 people, employees of the hospital, that have come in contact with individuals that have just come to different clinics and to the hospital system. So would you please make sure that if you need the health care, they are there, they are ready, they are prepared. However, please call in advance, because we need to make sure that that there is adequate number of healthcare workers as we move forward through this. One thing that I want to to stress, as I did the other day. This is a short blip in the history of this community. It will be very short when we look back. Let's just take a deep breath and let's have patience and kindness to one another. And just know that during the next couple of weeks, we need to spend time at home, which is really a pretty nice thing to do. When you start being around your wonderful family members, just take a moment, let's relax and pause and love your family. But with that as well is a requirement to love your neighbor. And so, because we have that spirit in this community, let's give them that 6 feet of distance, and let's really work on just pausing for the moment. The judge's order, which I support, is for 2 weeks. That's just 2 weeks in the life of this community. And I am told over and over at every one of these meetings, and if you could just be in there with me, you would understand what I'm about to say. Public health and the hospitals have made it abundantly clear the only way we can fight this virus is by social distancing. That is why we're asking, and we're all in this together, pause. Let's pause for 2 weeks of our life, and we will be so proud of ourselves after we have that pause, that we have actually done in a different way. Normally, mayors and county judges, we're calling you to action, to get involved and get involved in your neighborhood and your community and make a difference. So now it's so unnatural for us to be saying, please just stay at home. But that's what we need to do during this time. So we can do this. It's going to be fine. Spend some time. This is a faith weekend, as it always is in our community. The churches, the faith-based institutions are coming up with some incredibly creative ideas to share faith amongst congregations. So please take advantage of that. But let's stay home. And if you have an essential service, please go do your essential service. Please come home. In 2 or 3 weeks, I don't know what the exact time is. I'm not a scientist. But I will say there's going to be time, plenty of time for all of us to socialize in this community and be proud that we did the right thing. But let's just take this pause. So again, thank you very much to such a wonderful community.
Good afternoon. My name is Dr. Jeff Levine, and I'm a public health physician, and I'm privileged to serve this community as the local health authority for Smith County. I want to thank Judge Moran, Mayor Hines, and Mr. Roberts for their very important comments and directives today to the public and to the community at large. As I explained in a press briefing earlier this week as it relates to COVID-19, we have entered a phase of this respiratory infectious disease outbreak referred to as mitigation. What that means is that we're experiencing community spread of this virus in our city, county, and region, and one of our best opportunities to be prepared is to ensure that our local healthcare systems are able to systematically address the medical concerns of our citizens, whether they should experience minor symptoms or more significant illness associated with the coronavirus. That also means it is very important that doctors, nurses, and so many others in our healthcare community stay well and safe so that the capacity exists to avoid being overwhelmed and to reduce the potential impact of spread of this virus. As you have heard us say, one of the best means of slowing the spread of the virus and achieving these goals is social distancing. Today's announcements and directives from locally elected officials are intended to do just that, to take the next step in helping people to comply with social distancing measures by staying at home and venturing out only when essential to do so. Initially, 2 weeks ago, based on positive tests reported to the local health department in Smith County, the growth in the number of COVID-19 cases was quite small, numbering 5 or less. However, since last Sunday, the total number of such cases has more than doubled, most of that occurring in the last 48 hours. That is one significant reason why today you hear your community leadership acting swiftly to apply further mitigation measures, as I have previously described. As Judge Moran also mentioned, there were briefings yesterday with our healthcare systems that have prompted the timeliness of this decision. Today, we have with us the chief medical officers from UT Health East Texas, Dr. Tom Cummins, and from Christus Trinity Mother Frances Health System, Dr. Mark Anderson, who can provide you with updates on the current situation in their facilities. They can also outline how they continue to systematically prepare to provide the best possible care for you, the community, and any current challenges they may be facing. Let me say in closing that social distancing remains so critical to the integrity of our healthcare systems, and I strongly urge you to comply with what our leadership has laid out for you today. On a personal note, as a member of this community for more than 3 decades, I am confident that you will rise to the occasion.
Good afternoon. I'm Dr. Tom Cummins, the Chief Medical Officer for UT Health East Texas. I want to assure you that our hospitals are prepared, our caregivers are prepared. We've been prepping and meeting and drilling across our system, all of our facilities, for weeks to prepare for this. The real heroes for us are our caregivers, those in the ER, our ICUs, our patient care rooms, our clinics. They're here for you, they're here for us, and we want them to continue to be so. They're ready to take care of any patient who comes through our doors, from the mildly ill to the sickest ones. But if we get overwhelmed, our jobs get more difficult. As you've heard, there is community spread. We've been seeing a surge of patients to be evaluated in our clinics and our ERs and are being admitted to our facilities. We don't know how widespread it is yet. That's why it's crucial that we all take the measures to do our part and stay home so that we're not spreading this virus any farther. It's essential that people follow this order and stay home. Stay home so that our caregivers can be there to take care of you when you need them. If people think they might have COVID-19, we are ready to take care of you, but help us. Let us know that you're coming. Call the emergency room. Call our clinics. Call our physician line, 903-596-DOCS. We'll meet you at the door. We'll walk you in and give you the protection you need while our staff takes the protection that they need so they can continue to care for the remaining members of our community. If you're terribly, terribly ill and severely ill, call 911. They'll let us know that you're coming so that we can be prepared to take care of you the appropriate way. It's crucial that we follow this order so that we can all be here to take care of you when you need us the most.
Good afternoon. I'm Dr. Mark Anderson. I'm the Chief Medical Officer for Christus Trinity Mother Frances. Christus Health has been monitoring and planning for the spread of COVID-19 for many weeks, both in the U.S. and its international ministries. As such, we've had plans in place and ready to initiate depending on where the spread of the disease is and how severe it is. We have those plans in place, and many of them have already been actioned. We have ensured our supply chains of PPE, our personal protective equipment for all of our caregivers to ensure that of their safety and their ability to continue to deliver care. But you'll also notice some local changes. We've restricted visitors at all our healthcare facilities. We've screening visitors, associates, physicians to ensure that when they arrive to work, they are healthy and continue to care for our patients. We have established telemedicine portals in our primary care and specialty clinics so that you may stay at home and continue to receive basic care. That is ready and available. You can access also our 606 DOCS number and get information on COVID-19 and also speak to advanced practice clinicians to get reference to necessary testing. We are well prepared to handle this emerging disease in our community. Our caregivers and our emergency departments, all of our nurses, our physicians are prepared, trained, and adequately equipped. The mission of Christus Health is to extend the healing ministry of Jesus Christ. We continue to do that, not just by caring for COVID patients, but all manners of health care in our community, and we're going to continue to do that throughout this duration of this disease. Christus Health will continue to work with our city, our county, our state officials in cooperating and to ensure this does not reach a proportion that can't be managed. I believe that social distancing continues to be the best way to mitigate this disease, and because of that, we have 100% support behind the judge and the mayor and all of our officials in ensuring that we can continue to deliver care and provide the safest environment for you. Our facilities will continue to be that for you in our community. Thank you.
Truly, we are blessed here in East Texas to have such wonderful institutions of medical care. I believe they're second to none, and you can trust what you just heard from those medical institutions. Our hospital systems here are going to deliver great care to the residents of Smith County, I have no doubt. Before I take questions from members of the media who are situated in a separate room and will come one by one to the podium to keep our social distancing here, I do want to just talk a little bit about the order itself, to give information, a little bit more specific information about that order and how you can find answers to any questions you might have moving forward. As I said, I issued this order just a little while ago. I executed about 1 o'clock today and filed it with the county clerk's office. It will be posted on our website immediately following this press conference. It's also going out as part of the press packet, which can then be posted wherever it needs to be posted by the press, so that anybody in the public can access that. If you have not been to our website, smith-county.com, when you go to that website, there is a red banner at the top that says click here for coronavirus information. You can click on there, and that's where you're going to find a copy of this order. It's a lengthy order, but this weekend I hope you'll take time to read through it to determine whether or not you're included as part of an essential business, or there's an activity that you want to participate in that's an essential activity. If you have questions, my first response would be please go read the order. It hopefully will answer your questions. But I want to draw your attention to a few things while we are here together and while we have your attention collectively. First of all, essential businesses can continue. For guidance on whether you're an essential business, as I said, please refer to the order. Things like healthcare operations, grocery stores, banks, the media, hardware stores, firearms dealers, plumbers, electricians, laundromats, restaurants for delivery, drive-through, and carry-out only, professional services, utilities, companies, janitorial, maintenance. Those are but some examples that are included in this order and are included really across the board on all orders you see around the state and around the country that are essential services. Now, many who are regional companies or who go outside of Smith County often already know that there is a memo put out by the United States Department of Homeland Security dated March 19th, 2020. This is going to be sent out by us to the press as well as part of the press packet. It will be posted online as well. In there, you will see that there is a definition of essential critical infrastructure workers, which has been determined by the U.S. Department of Homeland Security. We reference this memo in our order, and if you are already included as an essential critical infrastructure worker, then you are included as someone who is exempt from the constraints of the primary provisions of this order. You can continue to go about your business so that you support the critical infrastructure of our country. You can still recreate outside so long as you keep your distance from others. Now, let me point your attention to two specific differences between this order and a lot of the other generalized orders that you see across the state. There is a specific provision there that if you're a patient that's tested positive for COVID-19, or you are awaiting your results and you've already taken that test, such that you've been deemed to be a PUI or a person under investigation, you have additional requirements to stay at home. Not only you, but those people that live under your roof need to stay at home. please take a look at that order in connection with those individuals, because those are the most likely individuals at this point that we can identify that might be carriers of the disease, of the virus. But as I said earlier, treat everyone as though they're a carrier, and that will do us all some good. Government functions are going to continue. Healthcare functions are going to continue. Law enforcement and emergency personnel functions will continue as well. Another difference between our order and most of the orders around the state, because most of the orders around the state, they allow for work from home. And one of the things as I looked at drafting this order that I wanted to mitigate was mitigate the impact on small business owners that really have no contact with the public, that they can conduct their business behind locked doors. So we've provided what's called a locked business exception. And this is in conformity with the requirements of 10 or less individuals within a business. But what we were saying is, look, if you can go to your place of business and you're locked in there, and it's you or 10 or less of you in that business, and you can conduct that business without interacting with the public and keeping your social distance, those requirements we've talked about here today, we want you to be able to continue on with that method, because that's just as effective as if you were to work from home. And we hope that will mitigate some of the financial and economic negative impact. But take a look at that provision in particular if you're a really small business that has no interaction with the public. Easy examples that I can come up with there is if you're a print shop and you're working simply behind the print shop doors, but you're not interacting or interfacing with the public, and you have 10 or less individuals and you can keep your social distance while doing that, you would be included in such an exception. Okay. Last thing I want to say before I bring up members of the media for question and answer is we're going to put out an infographic also that will give you just an easy way to understand what this order says. Legal orders can be complicated and arduous to read, even for those of us in the legal community. I understand that, so we want to try to make it easy on what you can and cannot do. But regardless of whether or not you can engage in an activity, engage in it safely under the guidelines that we've been giving you today and that the CDC has pushed out for several weeks now. Okay, let's take questions. Is there a member of the media that wants to ask a question? If you'll come forward one by one. And I'm just going to say right now, one of the things I'm not going to do is get into a drill of, well, is this business in? Is that business out? Is this business in? Is that business out? That's not going to be useful time for us today. So, Blake?
Sure. Judge, I'm curious. On Monday you mentioned there was no intention at that time of issuing an order like this. Similar message on Wednesday. What was the turning point between Wednesday and now that you decided this would be the best decision?
Yeah, it was that briefing, those sets of briefings that we got yesterday. I mean, we had been watching the escalation of the number of COVID-19 positive patients that had been tested here in Smith County. But as we received our daily briefing, when we received that yesterday and information was coming in about patients, especially the number of patients that hadn't yet been tested or tested positive but were presumed to have it, that was an issue that became concerning for me in particular, and I know the rest of the group. And then as we begin to also to hear about the stress loads and the need to logistically support those personnel in healthcare, as the mayor said, we've had at least 100 that have been come into contact with somebody that has had a COVID, and so we don't want that to get to a point where our healthcare systems are burdened with a number of employees that can't actually be on the floor providing health care. So those were two of the major things that we looked at. Next question. Corey, come on up.
Hey, I've got a couple of questions. First one, the order specifically says that exercise places like trails are going to be open. What about parks and playgrounds? Are those going to be closed down or limited?
Yep. For the time being, parks and playgrounds will remain open. I know the city has some plans to make sure that there's additional information pushed out through the city about that, and the mayor can speak specifically to that if you'd like to, but we talked about that as a group and decided that those need to remain open for now. Those certain activities like basketball courts, people shouldn't be playing basketball together. You're going to have close contact, but I know the city's going to go to extra measures to continue to clean those more often as well.
And then the enforcement mechanism, if it has to come down to that, is that going to be aimed more toward the individual or the property owner if there is a fine that has to be assessed?
Well, it's enforcement measures come down to people that are not actually complying. There is a criminal provision in here, so this is punishable by a fine up to $1,000 or imprisonment up to 6 months if you don't follow this order. Now, our hope is that we don't have to get to that point. Our hope is, as we mentioned on Wednesday, that folks will voluntarily comply with what is good common sense, and this order is an attempt to effectively put good common sense in writing. So our hope is that folks will comply and we won't get to that point, but it's there if we have to deal with it.
Okay, and then one thing we've been getting a lot from our readers is questions about the availability of ventilators in our area hospitals. I'm wondering if one of our hospital leaders could speak to that.
So as far as the ventilators goes, I would say, and I feel certain Dr. Anderson would echo, I think both systems keep a regular inventory of what we have. Do we have an infinite supply of ventilators? No. But we do take inventory every day to make sure we have what we need. And given the size of our system and the 10 hospitals, we have the ability to move ventilators around if we need to. And within the bigger part of our system can do the same. I don't think any health system would tell you that they have all the ventilators they might need, but we feel pretty comfortable today. But if things change, that may change.
Corey, we'll get a statement out from the city about parks, and I have infinite confidence in our citizens that there won't be any issues because everyone is so excited to do the right thing.
Next question.
Hey, Judge. Okay, so I'm wondering, will there be a number or a way for people to report if there's a non-essential business that is staying open?
What we're doing right now is trying to set up an email address, and we'll put out information about that later, but I think within the hour we should have the email address of covid19@smith-county.com as a centralized email address that folks can either send inquiries to if they have questions. In particular, if people aren't sure after they read the order if they're an essential business or they can operate or not operate or conduct a certain activity, that's the email address to send their question to, and we'll get back to them just as soon as we can with information and guidelines about their question in particular. And if they're seeing violations, that's the place to report those violations as well, in addition to reporting it to law enforcement.
Will law enforcement be policing at this time those businesses?
Well, that's something, again, we hope we don't have to do, but it is now something that's mandatory. And so I'm not here to say we're not going to enforce that, because we will enforce it if we have to enforce that with criminal fines and with penalties. So I'm asking the community to do the right thing and to step up and to take this action voluntarily pursuant to this order.
What does this order mean for our jail population at this time in the sheriff's office and the detention officers?
Yeah, we're fine in the jail right now. We're down to just over 800. I got a report earlier today from Sheriff Smith, and I think we're just at like 801, I believe, today. So we have the capacity to handle whatever we need to handle as this issue moves forward.
Are they continuing releasing those with pretrial misdemeanor hearings?
You'd have to talk to the sheriff and the DA's office about that. We've been wrapped up with this in the last few days, so in addition to what we reported on Tuesday, I don't have a further update on that.
This is kind of a joint question. Have y'all been looking into extra space for hospital beds if this continues to spread?
I'll be glad to let one of the hospital systems answer that question. That's a medical question.
Certainly for the University of Texas system, we have been looking at that and developing contingency plans where we can place patients both in the main campus, our Northeast campus, and other facilities. We've had conversations with another system about possibly using some of their beds as well. And so, yes, we are developing those plans to try and make as available as many beds as we need to.
And at Christus, remember, we're not just a single hospital. We have multiple hospitals through this region. Christus Good Shepherd, Hopkins County, St. Michael's up in Texarkana. We have multiple facilities between us. We have adequate beds to take care of patients and expect that to continue. We have many contingency plans to cohort patients together if we need to, but we're not expecting to do that. And part of the reason why is because we expect social distancing to be able to mitigate any surge we have. But that doesn't mean we don't plan for it. We'll plan for it and be sure that we're prepared for anything we need moving forward.
Okay, thank you.
Next question.
I think some of our viewers have they're a little confused about the difference between shelter in place and stay-at-home orders. Can you explain to us why you chose to issue a stay-at-home order versus a shelter in place?
Sure. Quite honestly, I think the shelter-in-place terminology is confusing to begin with, and that's why we chose a different terminology. The stay-at-home is really more in line with what we're asking folks to do. Shelter-in-place is more appropriate for a tornado or an immediate event where you need to hunker down for a short period of time. And so this is really, I think, a better summary of what we're asking folks to do is stay at home.
Okay, but it is still mandatory.
It is still mandatory. This is not a voluntary step. This is a mandatory order. It goes into effect tonight at 11:59 p.m. It'll run for 2 weeks. That means to the end of April the 10th, Friday, April the 10th at 11:59. That's when it concludes. Unless I extend it beyond that point by written order, or if I terminate it early by written order, which could happen. We certainly don't want this this mandatory order to be in place any longer than it absolutely has to be, but we'll keep it in place until we need it to be concluded. So, and from time to time there may be clarifications that be needed out of this order, so I may issue supplemental orders of clarification. These are very long, complex orders, and so we want to do our best to clarify those things for the community.
Okay. And I asked on Wednesday about trash pickup now that people will have to be home as opposed to choosing to be home. Is that something that we have been able to come to a decision on or have any information about?
I'm going to ask Ed Broussard, the city manager of City of Tyler, to answer that question.
Thank you, Judge. So on the question of solid waste continues with twice-a-week pickup for the City of Tyler, along with the recycling services. For those who are not on the City of Tyler, they need to probably consult with their solid waste provider. But for our solid waste services, we let those continue. One of the things we are concerned about and making sure our employees are being able to continue operations, extra precaution, gloves, those type of things in the case that the trash bags that they may be picking up beyond just as far as the receptacle itself may have been touched by someone who has had COVID-19. So there's precautions that we're taking, but with those, as far as actual solid waste services, will continue.
Okay, and the main concern was more that it seems like since even just when people were voluntarily staying home, there is quite a bit more trash overflow happening in apartment complexes, businesses, things like that. So we were more kind of concerned if we were going to possibly think about doing some extra pickups in this time.
We're not going to be doing extra pickups, but especially the two that you just cited sounded related to dumpster type of activity. And so for dumpster activity, we do ask for those as far as businesses, apartments, that they need to monitor what they're, as far as if they need extra pickup, those can be scheduled, whether it be the provider is from the City of Tyler Solid Waste or from other providers. But they need to, as far as look to see what is their amount, because like as you said, and we see that ourselves for our solid waste pickup, it is taking longer for us to get through our different routes during the day, but that doesn't mean that we're going to discontinue anything. It's taking us longer, and we ask for patience from our citizens who may have expected to have their trash picked up at 10 and maybe picked up at noon type of situation. But for those especially that have dumpster pickups, they need to monitor those and call those in if they need extra as far as service.
Sure who would be best to answer this question, but among the 27 cases in Smith County, were any of those healthcare workers by chance?
George, I mean, I can speak for ours.
Yeah, go ahead.
For the positive tests that have occurred within our system, none of those have been healthcare workers to date.
Yeah. The answer is yes, and I don't have an exact number, Blake, but the answer is yes. and it's my understanding it was not work-related.
Okay.
The case that I'm aware of was not work-related.
Was that a community spread case or a travel-related case?
Community spread.
And also, this may be for Judge Moran. I know some of our viewers are seeking some clarification on exactly how this will be enforced. Will this be now part of the routine patrols for sheriff's deputies and city officers now? How exactly are they going to enforce it? And if you could, again, reiterate what the consequences are.
Sure. This can be enforced by any peace officer in Smith County. So it's just like any other law that's on the books now. It's permitted for us to establish a fine of up to 180 days confinement or $1,000 fine. Those are the two penalties. Either one or the other or both could occur if somebody were to violate this order. Our hope is, again, that that won't be necessary, that people will comply. It is a mandatory order. People must comply. If they don't comply, any law enforcement officer in Smith County can enforce that order.
And aside from, essential versus non-essential businesses, I was reading through the order. There are some specific things for individuals, talking about social distancing and things of that nature. What do individuals need to know as far as what they can do and can't do?
Right. Well, the easy way to remember this, and I hearken back to a business law class I had in undergraduate. My professor back then, in trying to describe to our class what a tort was, he kept saying, use the ain't right meter. And he said, if it just don't feel right, if it ain't right, then it's probably against the law. Well, go back to the social distancing requirements that we've been just talking about as common sense. If it doesn't, if you're falling outside of those parameters that the CDC has said, it probably is not allowed in this order. So that's just a good gauge is just remember, keep your distance and wash your hands, do those things you're supposed to be doing. But unless you're engaging in an essential activity, that's probably a pretty good standard.
And this is somewhat of a specific question, but I didn't see it addressed in the order, and someone was asking us, are child custody exchanges allowed during this order?
That's really not a question for this particular order. That's a question for the court that's overseeing those cases. Judicial functions are going to continue. Governmental functions are going to continue under this order. So nothing in this order is going to affect the question you're talking about.
And this may be for the hospitals, but I want to go back to the ventilators. Do we have an exact number? I know Gregg County said they have 52, and then they have some other machines that would also be available to be retrofitted into ventilators. Do we have an exact count of how many are in the county?
George, you probably have that number better.
Yeah, I don't have the number right offhand. We have that information, but they also, I know from the hospitals, I got a chart that I have that I can share with you. But that's as far as I know. I mean, I don't have that number off the top of my head.
And are we looking to get more ventilators for Smith County?
Right now, at this particular point in time, Blake, there is an adequate amount of ventilators. But again, things can change. So we've been in contact. The hospitals are in contact. I've actually contacted ventilator supply individuals that can provide extra stuff.
As far as the testing breakdown goes, do we know a total number of samples that have been tested for COVID-19?
Are you talking about in Smith County? You're talking about in Smith County? Dr. Levine can tell you specifically as it relates to the what's called the FLET Lab, Public Health Lab of East Texas. I don't know the answer to commercial labs. There's a lot of commercial lab testing going on. There's a site I can look up the site on the Texas Department of State Health Services website that actually lists out the number of public health lab tests and the number of commercial lab tests that they're aware of. But Dr. Levine can answer specifically Public Health Lab of East Texas at this point.
So for the Public Health Lab of East Texas, since the inception of this testing, there have been 401 individual patients who have been tested. Now, the number of samples is slightly greater than that because initially we might have multiple samples on a patient, but now there is one largely recommended sample that is obtained on a patient for testing. I think hopefully that answers your question.
I'm looking up your answer right now. Jeff, just a minute.
I think that's about the policing piece. You might want to address that.
Sure, go ahead, Mike.
That'll give you some time on this.
That's true. Like you had asked about the policing piece, one of the things I want to kind of make attention to is our police department has been provided with these orders. And so we have already asked them to start this afternoon, starting to visit with some of the larger retailers about the orders, what it means. They also will be visiting as they see just as far as non-essential businesses may be operating, as kind of talking, counseling, asking for voluntary as far as cooperation first before any other further action. And so they will, and we've also working making sure that that is not just a patrol officer, but that's actually as far as police leadership, administration, sergeants, those that are out there visiting with some of our different businesses during today and into the early part of next week. The other piece is we've also put our police department on alert to make sure that for this afternoon, as people may start to say, well, I need to go run to this or run to that, to be able to be there for crowd control if needed or called upon.
And that's one thing I was going to ask about, if there was in fact a grace period as this order goes into effect.
There's not a grace period for us, though, as we know that many businesses are still going to have quite a few questions. We will work with them during this in order to make it happen. We don't just come down and essentially SWAT from at the right beginning. We want to just kind of educate, counsel, and then get to where we need to be.
Judge, I'd like to answer this ventilator question in a little bit different way. You're asking specifically how many are here in Smith County. But remember, Dr. Cummins and I work for very large hospital systems that have many ventilators, whether they're in hospitals, ambulatory surgical units, operating rooms, long-term acute care facilities. And so we have access to a lot more ventilators than even what we show on the documents that we're giving to the governor on a regular basis. So because of that, we have the ability to flex up ventilators if we need to. We can put patients in multiple areas of the hospital and support ventilator activities. So our ability to flex up goes more than what you see on a simple report right now. So.
I'm just going to echo what the city manager said about the policing as well. It's not any of the law enforcement's desire to go out and arrest anybody right off the bat. We're going to work with people and businesses about complying with this order, and I'm certain we're going to get compliance as we move forward communicating it out to the public. Next question.
Hi, Judge. Okay, so you were just saying how you're going to work with people and businesses about this. Will people be required to have maybe a permit in order to get to their business?
I'm not requiring a permit to get to their business. They're required simply to adhere to the language in the order itself. It doesn't require a specific permit or a pass or a letter. I know that there are letters circulating around that companies have done that say, hey, we fit within the critical infrastructure worker definition by the Department of Homeland Security, and that's fine. That's a great idea. It's a wonderful idea, but there's no requirement or mandate from me in this order for that.
And then if you continue to see those non-essential businesses and people still out and about, do you think that might be a route you take?
We'll deal with that when the time comes.
Okay, and then another question. Do we have any confirmed COVID-19 cases in any nursing homes?
Not to my knowledge, but I'm happy to turn that over to George Roberts, if you know any different.
So the nursing home, I was trying to find numbers here.
No, you're okay.
The question was
No
what?
confirmed patients in nursing homes.
I'm not aware of any.
I'm not either.
Thank you.
Thank you. Okay. I don't see anybody else stepping up to the mic for questions. Anything else to be said by anyone else up here? I want to say how much I appreciate all those that are in attendance today, in particular our hospital systems that have provided incredible guidance and wisdom and support throughout this process. And likewise, we're going to continue to support their efforts. You will find no better institutions than the ones that are represented here today. I want to leave you with this as well as a community so that this can be a thought in your mind as you move forward for the weekend. 2 Timothy 1:7 says, "For God has not given us a spirit of fear, but of power and of love and of a sound mind." Take that with you. Meditate on it this weekend. We wish you the best. Thank you.